straight for us, Gwen. She's concerned with these, this area under her neck here. She wants some lifting of this area, so I'm going to use some 19 gauge 100 millimeter threads, and I'm going to lift these up to help with these necklace lines. And then right through here where she's got this extra loose skin, we're going to use some smooth 38 millimeter threads, and we're going to crisscross through here to build collagen in this area to help smooth that. Initially today we're going to do the lifting with the barbed threads, and then we're also going to add some smooth threads to build collagen through this area. Let's get one from the other side. I like to do pictures from three sides, 45-degree angles for that. Lifting. Perfect. Here. And all right.
Good.
So again, we're going to be using the 19 gauge 100 millimeter thread.
Okay, thanks.
And these are the barbed threads. I want to go straight in, perpendicular at a 90-degree angle. Once I get into the subdermal, then I want to turn my thread, and I'm aiming, all right? I'm aiming right through here.
Okay.
You can see where my thread is going. Perfect. So we ended up right here, so we can get this nice little lift. I always like to push a little past where I want to go. Then I'm going to press down here, pull that straight out. So I'm going to keep my finger right here and rub up, activate those little barbs on that thread, and then rub down very gently. You feel that popping, Miss Gwen?
Not yet.
There we go.
Yeah.
Perfect. And those little, when I'm rubbing, I'm activating those little barbs, just popping those little threads, those little barbs out. And those, when you put the thread in, it's like this, and then when you rub back, they pop out just like that, and it causes, well, on that you get a little, you can see the tension. If your thread moves, then you need to reactivate your barbs. You haven't got them all activated. We're going to lay this thread right through here. We went up here with one, we're going to lay this one right through here. Okay. Don't move, just so.
Yes.
Rub those little threads. And Gwen, what's your pain level at this point?
None.
0? Perfect. So what you want is a pain-free patient, and she's having no pain because I'm staying in the subdermal with her threads. Feel that little popping occurring? Okay, perfect.
And threads.
Yes, sir.
Why is it that they really don't have significant pain?
Because when you are in the subdermal, there are very few nerve endings there, and when you have very few nerve endings, you don't have a lot of pain. So that's why the threads go into the subdermal area, is because there's not a lot of nerve endings there, but it's deep enough to give that nice lift of the tissue. So with the threads, if a patient has pain, when you're inserting the thread, you know that you're either too shallow or too deep, or there's a little nerve ending in the area that you're in, so you just make an adjustment, readjust your thread, and advance it further to stop the patient's pain. I'm going to do 2 there, and I'm going to go a little bit lower here, and we're going to do 2 more. So this necklace line here is already gone, so she's still got this one here. I'm going to go a little bit lower here, Gwen. I'm going to blend this up. 20 degrees. Once you get in, you want to flatten out your thread right into the subdermal, right along that little neckline, that little necklace area. Perfect. Nice and anchored. See how we're getting rid of this? Nice and anchored. Perfect. One more in that same area. In that same hole. A little bit lower with this one. We were right here for that one. Going just a little bit lower with this one. And again, we're just activating those little barbs, those nice little pops.
Open and crackling.
And pull this up so you can see those are nice and cinched in place. Okay, so I'm going to do the other side, but see how this is already disappearing here from just these threads, and we haven't even built this striations over here. These are smooth, whereas these on this side are still here because we haven't done this side yet, and her necklace line is still here on this side. Head back, look down. Okay, head down. Perfect. Now, her little striations that she had before have been removed by pulling everything back and tight. So, post-care, let's talk about that. First of all, how much discomfort was the procedure?
None at all.
How's your pain level now?
Good.
None? Okay. You probably feel a little tightness in this area. That's completely normal. You may, when you turn your head, bend it one way or the other, you may feel the little threads popping. And if you do, that's not a thread breaking. What that is, it's just an extra little barb on the thread that just opened up. So don't be worried about that or concerned. So no heavy massaging or rubbing. No facials with neck massaging for the next month. Sleep on your back for the next at least week. I prefer 2 weeks if you can.
Okay.
No lasers or anything that would manipulate the skin for 1 month.
Okay. That's no problem.
Any questions for anything?
No, you did good.
Perfect. All right. Let me hug, baby.